All right. So I'm Autumn Friend. It's been a couple of months since I presented a little bit on our cancer program, so I want to provide some updates. I am a registered nurse here at the Health Department in Personal Health, and I'm also the coordinator of our cancer screening program. And there's a lot of new things coming in the next fiscal year that I'm excited to share with you all. Can I just hit the over button? Like that? Perfect. Thank you. So I want to start with talking about what the cancer program actually does. There's a lot of questions from community members and providers, so I really wanted to shine some light on what we do. This program offers cancer screening at no cost to eligible Garrett County residents for skin, colorectal, and now lung cancer screening. So what that means is we are a payer of last resort, but we offset all of the costs associated with screening. So even if someone has Medicare or private insurance, they may still qualify for this program because co-pays, co-insurance, deductibles, all of those are ones that we could cover because some of that, is really hard for people to meet. The skin cancer screening consists of a simple visual skin examination that's done by a dermatologist. We have a contract with Western Maryland Dermatology. If the provider performs a biopsy of a suspicious lesion, that is also covered by the program to rule out cancer. And then any associated treatment is paid for as well. A colonoscopy for the colorectal cancer screening, including all of those associated fees, is covered under the grant. If a colonoscopy is not indicated for a patient, or if they decline, we also offer FIT testing, and we now offer Cologuard testing as well. I do want to reiterate, though, that the FIT and the Cologuard tests are only for average risk individuals of colorectal cancer. And the lung cancer screening, this will be starting on July 1. I'm really excited to introduce this to our county because we have some pretty high smoking rates here. It is a simple, non-invasive, low-dose CT scan. They can have it done here at the hospital, and it's just a detailed image of the lungs. This super busy chart, these are the performance measure updates throughout the fiscal year from this grant. So the numbers that you see under each month is the total number at the end of the month. So for example, number of education outreach activities done by last July, 0. We had completed 0 in the first month. And then in August, we had completed 1. All the way at the end, that's this month, June, because our fiscal year is ending. Everything that you see highlighted, all of those performance measures were either met or they have been exceeded, which is actually a huge thing for this program. Since I started 2 years ago, none of the performance measures have been met until this year. So the only ones that we did not meet were the number of tobacco cessation referrals. A lot of people do decline referrals because they're not ready to quit. And the other one was there is a performance measure of number of non-Hispanic or Black African-American individuals screened in the county. I only did 1 this year. Our population is predominantly white. I have tried to discuss that most of our minority population is those of low socioeconomic status or our Amish community, but they still have their rules. So we're going to keep working on that. I have been working with John to put some stuff out for that target audience for next year. Okay, I wanted to clarify some of our breast and cervical cancer program questions. This program was regionalized to Allegheny County in 2020 for Garrett and Washington County. The reason I'm touching on this is because a lot of providers in the area think that this is no longer available to our community whatsoever, and that's simply not the case. The regionalization was due to the steadily decreasing number of participants in the program for both counties, especially after the pandemic happened. What this means is that the grant funding for this program is now only distributed to Allegheny County for Garrett and Washington. So they are our central hub. So instead of dispersing the money between the 3 counties, it just goes to Allegheny. However, Allegheny County Health Department has contracts with Oakland MRI, our hospital, Cornerstone Family Medicine, and I believe now Wellspring and Garrett Medical Group. So our Garrett County residents still have access to that service through those contracts. So if anybody, excuse me, is in need of the mammogram or any other breast or cervical cancer screening, Garrett County residents are still completely eligible for this, and it is available. It's just some more red tape. So, yeah.
Do you still have funding for outreach for breast and cancer, cervical?
Yes.
Or is that good? Does that go to Allegheny County? Because
we do still have some funding within the grant. I break it down a little bit to where I can, order some print flyers or brochures and things like that. And our education and outreach team here at the health department also does breast and cervical outreach as well during their community events. I also have a pretty good relationship with Ellie Folk, who is the coordinator at Allegheny County, and she sends me a lot of the stuff that they have for me to just distribute with our county as well.
But the intake would have to be in Allegheny County.
Yes.
They can't do the intake up here.
They do everything by mail, so they don't have to go down to Allegheny County or anything like that. They can sign their consent forms by mail, send everything that way, and just coordinate them with a provider up here. Any other questions? Okay. Next thing I want to talk about is how 45 is the new 50. This has become a huge slogan for colorectal cancer screening. The United States Preventive Task Force and the American Cancer Society lowered the recommended screening age for colorectal cancer from age 50 to 45 in 2021. So a lot of people still believe that you don't need colorectal cancer screening until you hit 50 years old, but it's actually at 45 now. This change was driven by a rise in colorectal cancer cases among younger adults, prompting experts to recommend earlier screening to improve early detection and treatment options. Studies have shown that earlier screening is cost-effective as the benefits of detecting and treating cancer early outweigh the costs. After age 75, colonoscopy recommendations shift toward individualized decisions based on risk factors, family history, prior health conditions, and then it's generally not recommended after age 85. So I do believe a lot of the providers in our county are pretty up to speed on this, but I do try to do a lot of outreach just to remind them, if patients are coming for their routine exams or anything and they're 45 years old, to start referring them for their colorectal screenings. Lung cancer screening, this is going to be what's available through the cancer screening program starting July 1. Jessica Carey, our clinician up in personal health, and Mountain Laurel Medical Center providers have agreed to partner with us to make this screening available. These providers will help determine patients' eligibility for screening based on their smoking history. Again, the primary method used for screening is a low-dose CT scan, uses a small amount of radiation to create a detailed image of the lungs. There are other risks for lung cancer screening, such as radon exposure, other things like that. But for screening specifically, the determining eligibility is smoking. And I'll get into that a little bit on the next slide. As of June 10th, we are now contracted with 4 pulmonologists at Ruby WV Medicine. My goal was to get 1, but I got 4. So if a patient has an abnormal lung screening, they can be referred to a specialist for further diagnostic testing, such as bronchoscopy, ultrasound, biopsy, anything like that. And that will also all be covered under this grant, if indicated. Another thing, patients do not have to quit smoking to get this screening. They don't even have to be enrolled in some kind of smoking cessation program. We can educate and advocate for that, but a lot of patients have said, well, I'm not ready to quit, so I don't want the screening. They don't have to quit.
So are you saying they're screened here, but then where would they get the CT scan? Would that be local too? Or
they're screened at the hospital. So what they'll do is they'll see their, primary provider at Mountain Laurel, or I could refer someone there, or they will see Jessica Carey. Basically, we go over their smoking history, calculate their pack years, see if they're having any other symptoms of like COPD, emphysema, anything like that, to refer them to Garrett Hospital. They'll have their CT scan done there. And if anything is abnormal and they need any further diagnostic testing, they'll go to Ruby, because our hospital doesn't quite have the facilities for that. So who should consider lung cancer screening? Excuse me. According to the guidelines from the U.S. Preventive Task Force, lung cancer screening with this CT scan is recommended for individuals who are between the ages of 50 and 80, have a current smoking history of at least 20 pack years, that's 1 pack per day for 20 years, or currently smoke or have quit in the last 15 years. So even those who have quit can still be screened as well. This is just a fun little picture of how to calculate your pack years. Number of packs you smoke per day times number of years you have smoked equals that patient's pack years. Last thing I want to talk to you guys about is there is a streamlined referral process now for our cancer screening program. A lot of things were done by fax and mail, which can be a little bit slower. So John has graciously helped me create this program referral form and put it on our GCHG website. The top link that you see, I'm happy to share via email or anything with any of our county providers or anyone who would like it. You can also get to this referral by just going to the Garrett County Health Department made website, clicking on all these tabs, and then you'll get the referral form. It is confidential. All patient information only comes to me. I'm the only person who can see it. And you can also refer yourself. It doesn't have to be from a provider. Anybody can refer themselves. If they're having symptoms of colorectal cancer, they find a strange spot on their skin, anything like that, they can refer themselves with this as well. That's all I have. Wanted to give some updates. Any questions about anything? Yeah, I think this is recorded, so you guys will still have this information as well. And then if you ever have any questions, please feel free to call or email me. Happy to give more info. Thank you.
Our next speaker is Brian Bailey with School Health Clinics.
So I'm tag teaming with Corey Evans. Corey is our business development and community relations manager. So I'm actually here. This is a collaborative effort between Garrett County Health Department, thank you, Jim, and Mount Laurel. So this was a follow-up to a grant that was awarded about 2 years ago to the Garrett County Health Department. And Jen had asked Mount Laurel to be a participant in this. So just a little bit of background. We're going to talk about why we're talking about school-based health centers, purpose, findings, results, etc. up on the screen. So we'll walk through some slides. So a little bit of background. Garrett County Health Department was awarded a 2-year state grant to do a needs assessment for school-based health across Garrett and Allegheny County. And if the needs were indicated, a business plan for school-based health services as needed. Grant was to assess our county's readiness for Pillar 4 of the Blueprint for Maryland's Future. If you're all familiar with that, that was commonly referred to as the Kerwin Plan years ago. Across the state of Maryland, this was a summary to make sure that we are investing in our educational services across the state of Maryland. Blueprint was passed. Pillar 4 is really where this is addressed, is more resources for all successful, not necessarily school-based health, but adding resources in the schools to help them. School-based health nurses, behavioral health services, school-based health could be a part of all this. So more resources for students. You can see community schools, concentration of poverty grants, and targeted for underserved students. So this is really making an effort to try to connect students who are not accessing primary care on a regular basis. So that is what the study was there to look at. What are school-based health centers? So they provide primary care and other services in or near schools. You've seen one school-based health center, you've seen one school-based health center. They can be embedded in bricks and mortar in school. I've seen them built behind schools. I've seen them built near schools. I've seen mobile. I've seen them coming 1 day a week, 5 days a week. It is really, there's no prescribed thing other than you are providing care for students who are not accessing care. So located often in communities with higher rates of free or reduced lunches, common services, chronic illness management, immunizations, reproductive service, oral health, substance abuse. It can be a whole bunch of things. Again, you've seen one. Not all have all the services. Often sponsored and operated by local health organizations such as community health centers, hospitals, or local health departments. Sometimes to a lesser degree, schools themselves manage this. But typically the licensure is community health centers, hospitals, or local health departments. Common characteristics, I'm not going to read all these, but again, being integrated with the school. This is a partnership with the schools and the health departments typically. This is, you're invited in. We always kind of joke a little bit, like vampires have to be invited in. School-based health centers, you need to be invited in by the schools. You don't just show up there. A variety of services, multidisciplinary teams. Again, what do you want to add into that school-based health center depends on what the school is looking for. Very important, all of this, in addition to the quality of healthcare that we're adding, is also parental consent. You're not just there to grab a kid out of the school. The school health nurses are already there to help triage sick kids or other issues there. This is not the school. Does not take away the school-based health nurses' role, nor the behavioral health team that's already in the schools. It is to enhance that. So in order for children to access the school-based health, whether it's for wellness, immunizations, sick visits, consent is important. And we all know that medical consent and behavioral health consent ages vary by state, vary by a whole bunch of things. So consent is a very important thing as part of all this. And again, thinking through all of this, it can be, medical providers, behavioral health providers, dental providers. There's a cadre of services that can be provided there. So, and then working with your community representatives and the parents. This is a collaborative effort with the schools. Preventative health care, reproductive health, mental health. These are just some of the things that can be done. Again, not always embedded in every school, but these are within the scope of what school-based health centers can do across the organizations. So I'm going to let Corey do this because Corey was really the master of this and kind of got this launched with us, and give a little background on how we accomplished this.
So why do you do a needs assessment for school-based health centers? You do it to assess the unmet needs and barriers to care for students. But you want to use that data to guide potential development of the school-based health centers and the services. And then you want to use those findings to engage stakeholders and guide the implementation of the school-based health centers and the services. Now, there's some limitations to what we were able to do. Now, as Brian mentioned, Jen and team approached us at Mountain Laurel. We weren't able to do a lot ourselves, so we did recruit the help of the WVU School of Public Health and 2 Masters of Health Administration interns, Lydia Farrell and Megan Townsend. They were a huge help to us throughout the process. But we were trying to do in 6 months what typically takes about 2 years to get done. So there's not a lot of primary data in the needs assessment. It was a lot of secondary data analysis. But we did what we could with what we had. But Megan and Lydia spent a lot of time engaging. They engaged with us. They engaged with officials from both health departments, both school systems. They got perspective with payers. Maryland Physicians Care was engaged throughout the process. They were able to talk to some folks from downstate, from the Department of Education, and they did talk to some evaluation experts as well throughout the process. So, some of the key findings. So there's some racial and ethnic disparities, and that may sound a little odd, but what that looks like for this assessment is the population in both counties are predominantly white and Caucasian, and so there's smaller pockets or smaller percentages of racial and ethnic minorities. And typically those smaller percentages have difficulties accessing culturally appropriate services and care when needed. And so that is something that has been highlighted in both counties as students may struggle with. Socioeconomic need, there's high rates of poverty and food insecurity in both counties, and particularly high percentages of families living at or below the federal poverty level in both counties. Healthcare shortages, both counties are designated HPSA shortage areas. I'll talk about a little bit more about that here in a minute. Chronic conditions, Garrett County, and this was a little interesting. There were noticed higher trends of asthma, allergies, and seizure disorders in Garrett County, and that's relative for the lower population of students in Garrett County. Mental health crisis, I don't think that's necessarily a surprise, but as a coordinated community supports effort out there, is trying to address that. And as round 2 gets going here later on this summer, hopefully there's a difference in that. Chronic absenteeism, specifically in Allegheny County. This was concentrated at certain schools, but there doesn't seem to be an easily identifiable cause to the absenteeism. But I know that the school district down there is going to be diving into that this year. So some of the demographic data. This just speaks to the population across both counties. So you see Allegheny County school population is a little more than double that of Garrett. Gender, both counties lean a little more male than female. Both counties are predominantly white. Garrett County more so than Allegheny. And then we have the smaller percentages of racial and ethnic minorities that I spoke of. Socioeconomic indicators. So high percentages of children living in poverty, as I mentioned, high percentages of single parent households. Both of those have been on the rise. And these are from the Robert Wood Johnson Foundation and the county health rankings. Uninsured children, these are actually the lowest that they've been in years, but it'll be interesting to see if they stay that way with changes going on at the federal and state levels. And then homelessness, both counties right around 5%. Free and reduced lunch. This is the percentage of total students in each county that are eligible for free and reduced price lunch. And in the state, both counties are significantly higher than the state average. This is the health professional shortage area. So the way that this reads, the higher the score indicates the greater need for health professionals in that area. This is for Allegheny County. The FTE shortages, so one FTE is one provider, one whole provider short. So you can see the primary and dental care shortages are a little bit more exacerbated than the mental health shortages are, but funding in the mental health arena has been the focus for a few years now. So I think you're seeing that start to catch up a little bit. And then Garrett, kind of the same. Garrett's population is a little less, but both counties struggle with that. And then this is data from the youth risk factor survey and the youth tobacco survey. So the top, I guess the left question for you all would be felt sad and hopeless. And then the right question is mental health not good. You can see high percentages across the board for all of those. But specifically middle school seems to be struggling more so than high school. And this is absenteeism data. This is data, I believe, it is available to the health departments. I'm not sure if the school systems have access to it, and I didn't have access to it. Megan and Lydia did, so forgive me if I'm wrong, and Dr. Porter may have to interject if she's on the call. But I believe this is the percent of absenteeism based on the student population per county. And you can see there's some fluctuation throughout the year there. The spike, of course, in December around the holidays and with the weather and whatnot, sicknesses and stuff happen in the wintertime there as well. So that's not out of the ordinary. And then particularly those in Allegheny County, so the unexcused absences, Fort Hill, Braddock, middle, and then Beller Elementary. They struggled with the unexcused absences, and then Fort Hill, Braddock Middle, and then Washington Middle struggled with overall attendance. And like I mentioned, I know Allegheny County Board of Education is working on trying to drill down into what's causing these issues for them. Get back to Brian.
So, out of these needs assessments, we need to categorize what are the potential next steps. So obviously prioritizing school-based health in the highest need schools. School-based health is sometimes a numbers issue. So when you have smaller schools like Swan Meadows, which I think has maybe 70 students there.
30
now. Setting up a school-based health center would not make sense. And so usually they're set up in larger centers or congregated where there's a higher cluster of patients. But looking at the primary mental and dental care access, obviously those are the needs that we were seeing out there. So what we've already done is we've already been meeting with Garrett County Schools and Allegheny County Schools. So Garrett County Schools met with them a couple of weeks ago and presented the data, and there was more detail associated with all of this reporting so they could absorb that. Garrett County, our initial discussion with them was what they would prefer to do is a more collaborative approach. So instead of setting up school-based health in the schools, what we advocated for was the Mountain Laurels, the Wellsprings, the Cornerstones, and the Love Lights work with the schools to make sure coordinated care is happening. So we're in agreement, and we will be working with those primary care practices to let's figure out how we can better coordinate across the county so there's access to care. Allegheny County Schools is a little bit different. They've actually said they want school-based health centers. They want bricks and mortar school-based health center. So we're already working with them on a Western Port Georges Creek hub. So we've already started the planning and the recruitment for that. And obviously with the issues that went down there recently with the floods, et cetera. But we are currently working with Allegheny County Schools in that area to establish starting at our Western Port practice, but then moving into one of the schools eventually after we get this up and running. Cumberland is another area that Allegheny Schools has asked us to do. So I will tell you that Mount Laurel's already engaged with the schools and also UPMC to establish a new practice in Cumberland, which will help alleviate their need up there. Partnering, obviously, with the local organizations is important. So we will continue to work with Jen and the team in the health department to look about where there are. There's funding out there through HRSA, through federal grants, through the Maryland School School-Based Health Center model. So we're working with them to make sure how we can get this funded, how we can get the appropriate staff there, but engaging our families through awareness and outreach is important. Again, stressing that the needs assessment was for each county, and the county results were different. So a business plan for Garrett County is not needed, but a business plan for Allegheny County is underway. And so we'll be moving forward with that. Just as an aside here, again, this is a growing interest. School-based health does exist in Maryland, largely in Baltimore and on the Eastern Shore. West Virginia, I believe there are 34 counties in West Virginia. The school-based health exists in 31 of them. So it is, and the latest initiative is that they want that in all counties. So where it doesn't exist right now is Preston, Mineral, and Mon counties. So we'll be looking at that also with the West Virginia Primary Care Association. So the steering committee, this was a collaborative effort between a whole lot of people. We appreciate the efforts. You can see the representation of the county schools as well as the health departments and other interested parties. So we appreciate everyone's help in getting this done. But wanted to present to the Health Planning Council, and if there was any questions that you have related to this, we can entertain you.
So you're providing services just for the children that are in the school, not necessarily for their families. And I mean, the old FQHC or the federally qualified school-based health centers had requirements to be 24/7, available and to be able to serve the kids and their families. And so that's not a requirement here.
No, that is a great question. Up for the community health center, school-based health centers, what you provide them is for the children, their families, and the employees of the school. That they are open to everybody. They're open to the community if you want to, but they're largely for the students and their families and the employees of the schools.
So that's what this is. That's what this would be.
That is what if community health centers are going to do it, that's what we would have to do. That would be our requirement.
Okay, good.
Cool.
There's another FQHC in the Cumberland area.
Yes.
How does that relate to your FQHC?
They are aware of what we're doing. And like I said, we were invited to do it by the Allegheny Public Schools and by UPMC. Tri-State is there.
Tri-State, yeah.
Yes.
That's it.
We were asked to do it.
Strange.
Agreed.
So you're already you have the federally qualified health center. So you can expand into this type of program without a lot of red tape or anything.
In order for us, for Mount Laurel, or any FQHC set up additional site, you have to request to HRSA that there's unmet need, and that if you demonstrate unmet need, then you will be granted what's called a change in scope to establish a new site. We can't just plant a flag someplace. And we've done the due diligence, and of course, Cumberland area, there is unmet need. And Tri-State is aware of that. I've had the conversation with them. This is not foreign to them, but we're transparent with them about what was going on.
Or are they doing it in Washington County and Tri-State?
Washington County, there is who's in Washington County? I can't, I know Frederick, oh, Hagerstown. Hagerstown, they do, school-based health, they do some mobile, they do some dental, and so, and they're actually going to be a resource to us to help us through this.
Brian, have you been able to meet yet or be introduced to the new superintendent? I know Debbie Matheny is also leaving, the Director of Student Services in Allegheny. I have
Yeah,
not yet, but I look forward to it.
Yeah, I reached out to Deb. Yeah, the new superintendent starts July 1st, I believe. So I let Deb know that we need to get in front of him. So.
Great. He has experience in previous positions. I believe it's on the shore, but with school-based health centers.
Yeah,
Yeah,
and also Howard County, I think. So he
that's
was
right. Yep.
not school-based health, but he was a superintendent of Howard County also. Cool, exciting. We'll keep you guys up to date what's going on there, but it's exciting efforts.
Next speaker is Melinda Smith with GIS. Melinda, you can-
I'm just gonna look, I don't know if you guys know, plug my computer in, pull up. It messes with.
We should probably pull it up on here.
Okay. Can I like just share it with you real quick? Or,
Give a presentation.
yeah.
I put Kennedy, help secretary. Let's see, the nature package course. Yeah. Like what you used to do with your cats.
Yeah, we told that into anybody else.
It gets sick.
That requires experience.
I know, that's right.
Word. Okay, everybody divert their eyes.
I'm just gonna stare at you, John.
You just don't want you to-
Just stare at each other. I have enough paperwork already.
They didn't do yellow ones and,
I'm gonna download this Google Slides. It's a little finicky on this computer.
he's out there fanatic or something like that, you know, that he's own, has his own axes to grind or something, you know. Yeah, he doesn't base anything on evidence or something. Yeah. My conspiracy theories, yeah. I explore Facebook.
All right, good morning. My name is Melinda Smith and I work here in the health department in environmental health. And I'm here to present to you guys today about our web map, which is a new collaboration with us and Sierra Whitfield, the county planner over at the courthouse. It's been in the works for probably the last couple years now. We've been working on this and finally to a point where part of it is accessible to the public. And I want to talk about that, and I want to talk about all the potential projects that we have coming up that involve this map. So when you go to the map online, it's maps.garrettcounty.gov. This is what you see. This is a map of the county. You can like zoom to scroll or use the plus or minus in the top left-hand corner. But then first, there's the option to choose your base map. So there's several base map options, imagery from several years, or you can just do streets. And then there's the layers that you can turn on and off. You can select which layers you want to see on the map when you're looking at it. And I clicked on a few that we typically use as far as the parcel view to see property lines, streams, sewer service, buy downs, but there's lots of layers on there that are applicable to other departments in the county, and but not all of these are accessible to the public. I think their layers list is a little shorter. So the big one for us is the well and septics. This is actually a view only for our office. the public can't see this right now. Eventually we would like to give them access to see the well locations, but not like the septic locations yet. But this is great for our office because when we're going out to properties to do site visits, we can just on our phones or our tablets, it's linked to the GIS satellites and we can enter those points. And as soon as someone in the field does that, it just automatically uploads. And so you can see it in the office as it's happening pretty much. Sierra has created the radiuses for 50 and 100 feet on wells. And then the two different shades on the septics are proposed areas. So lots of parcels that have approved septic areas that have not yet been installed would be that lighter shade. And then the orange is an actual system that is installed. This is another view. So this comes in handy whenever we are approving construction releases. When I'm in the office working on a construction release, I can have someone go out or I can go out and I can site the well, the septic tank, the drain field, and then I can put on there the whatever they're proposing to construct, a garage or a deck, and make sure that that doesn't interfere with any of the well and septic on site. Whenever we're going out and doing septic finals, we can create this shape and attach photos to it. So this is really big for us and super handy now and like years in the future. If I can imagine just having this at certain points in the past, but it's really simple and easy to upload this whenever we're out in the field doing a septic final. Just take pictures and attach it, and then it's there to look at. Right now, just us, not yet the public, but for a sanitarian that's going out and doing field work, this is a huge advancement to have this information, especially when it's all covered up and there's grass or maybe a garage or something.
Yeah, they've been inexperienced.
So we also use this now when we go out and do perk test. So when we do a perk test on a property that has not yet been developed, we can put in our perk hole or our deep hole locations. Yeah, and then like the time and date is stamped on there for whenever it was completed. And you can also attach pictures. So under attachments, photos, I don't know if it's there. Oh, it is there. I put a picture of my deep hole. So when I'm out there in the field, I can attach that photo and then it's just there with that property forever. This is something that we're working on, but is not yet available. But this is our typical form that we use whenever we're going out and doing perk tests. And we write pen and paper and bring it back in and it goes in the file. But it's in the process of being made digital so that when we go out and do a perk test on a property and we add that location, our form pops up and we can fill it all out online, and then that information is always there. We don't have to worry about papers getting wet, muddy, lost, misplaced. It's all attached to that property, and it saves time because it's already scanned in basically to the computer for other people to look at. There's also drawing features on the mapping tool. So we're trying to make lines or areas that's available to us for site plans. And then this option is available to the public. So we've been trying to get our septic installers and contractors onto this to create site plans for us to show us whenever they're doing any kind of construction or addition or installs on the drain fields. They can use this to give us accurate pictures that are to scale. There's the measurement tool. The measurement tool up there to, again, use to just measure distances and areas. Another layer that we use a lot is the one that shows us public sewer and water to certain properties. This one's really helpful. It is all the blue line streams and non-blue line streams in the county. And then Sierra added the 100-foot setback on it for us as well. So that's important whenever we're going out and creating site plans, that setback's already on there and I don't have to measure it out. She's created that. And then she's also created, it's a little hard to see, but there's like this lime green, yellow. shaded area, which is the buy down around the lake. Our subdivisions are all pinned on this map. So when I turn that layer on and all these little pins pop up, I can click on it and it tells me the subdivision in that area. And eventually something that we're working on is getting plats kind of linked to that so that I can click on the subdivision and then the plat's scanned in and I can look at the plat for the subdivision showing well and septic areas. Other applications are the lake and beach sampling points. So when we've gone out, we put in our points where we're doing our routine lake monitoring and beach samples. Eventually, I would like to have the data connected to this, whether it's public or not, but then you would be able to click on any of those sampling points and get our sampling data for that point. And really anything that I have data for in the computer, Sierra can turn into a layer for me, which is really nice. Things like high arsenic, all of our water samples get entered into the computer. So I have all of that data. And if I want to see it on a map, she can stick it on a map for me. I've also used it for the tick surveillance program. And this is something that I do want to try to get on public, maybe this summer sometime, but it shows all of our collection data when we're going out and doing surveillance. So you can click on any of those points. And right now it gives you all of the information that is on the CDC form that I have to fill out whenever I send those ticks in for testing. So I don't know that I would include all of that information, but some of it maybe, and maybe our pathogen testing data. I have to still refine that as far as, you know, what to make public and what not, but at least they'll be able to see that we're going out and we're doing this work and what we're collecting, the species that we're getting, life stages at certain times of the year, all of that will be shown on the map. So whenever anyone from the public wants to get on here and look, you can search by address, but you can also search by map and parcel for the tax account ID. You type it in and hit search and it'll take you right to the property that you're looking at. And then this is the part that is out there for the public, is the health department document search. So once you go to the property that you're interested in, click on it, you have the link there, and it'll take you to the cloud with the well and septic permits that we have on file for that. So this saves us a lot of time with realtor requests, because, you know, normally we would have to go find this information, scan it. If it's not already scanned, email it back to them. But now we've shared this with all of the realtors. We've shared it with contractors. We've shared it with home inspectors. So whenever they want a well or septic permit, they can just get on their phone and pull it up themselves.
So you can see the diagram of the septic
Yeah.
installation.
Yeah, you can see both sides. And then they can also like click on the well permit and they can view the completion report for the well permit. Any correspondence that we have on file, like emails and things like that, those are not open to the public. They're only seeing just well and septic permits.
That's important because a lot of these septics are buried and you don't really know where the tank is. And
Right.
the drawing on the back of there gives you a good idea where to look.
Yeah, sometimes, yeah. It's really helpful. And with
Depends on how
realtors,
good the drawing is.
yeah, they really want to know number of bedrooms. So it's been a huge time saver in our office. And it makes me hopeful for the things that we can do in the future, collaborating with the county, having things online for the public or contractors to get on and view. And
Sierra's great.
so far it's been going really well.
Did you ever think about putting positive rabies cases on that map every year? Because I know back, how many years ago, 40, 35 years ago, we used to put pins where the rabies
Yeah.
cases were on the map and you could see what part of the county you were more likely to encounter a raccoon with rabies.
Right. No, we don't currently have a layer for that, but we absolutely could if that's something that we wanted to do.
I mean, where's the concentration of raccoon rabies today and
Yeah,
where it might be going tomorrow?
yeah, right.
Might be useful for the public.
We've been radon too.
Yeah.
There's a lot of interest this last all years about river chemicals in the drinking water.
Mm-hmm.
What's the quality of drinking water in Garrett County in relation to river chemicals?
Well,
Bacteria.
I think that, you know, I can only speak to the private side, like private wells that are being drilled. I don't know anything about public water, but there are regulations in place, you know, with well construction to do the best to ensure safe drinking water. But you can see I've noticed more arsenic recently. I haven't been able to pull any data to look at a trend over time. It's just kind of my feeling that it's like, I feel like I get more high arsenic levels than I did 5-8 years ago.
I don't
But-
understand that now. So what do the blue areas represent?
The blue areas are points that had arsenic in the water over the maximum contaminant level.
But they're not really points. That's a big area on the map. The blue.
Well, it is a point. This is just a picture, but if I could zoom in, like,
You would get the property.
yeah, it's like a rectangle with a pointed bottom.
So the larger the blue area, it means it's more extensive.
More
You have more data for that area.
Right. Yeah, more data, more concentrated. But if I could overlay like the geological picture on this, you would see where you can kind of see it on there where the rock is, you know, over time. The arsenic always shows up in like the old rock.
And the roads would be good on there too. They kind of overlay map for the roads and or the properties.
Yeah, and I could turn it on if I want to look at that.
Can't turn it on from there.
Yes.
Can you elaborate on the difference between the state and local data? You said state information isn't on this, but this is just local data. That's what I heard.
This is just local data. I don't think that the state has anything like this in place. So this is just something that we've done in collaboration with the county, is create this web map. I think that there might be one other county in Eastern Maryland that has created something like this.
But all the public water supplies and all the information they have is not on this.
Because it.
Right. Yeah, I don't have any information on like public water supplies and their testing results.
Would that be important to look at both at the same time?
I guess it would depend on what I'm trying to do. I mean, I can, you know, the work that I do, I can only regulate and enforce those regulations that are applicable to private water supplies. So when people call in with issues on their public water supply, I just have to forward them to, you know, that town that is in charge of it. And they have I'm not familiar with their rules.
Well, unless you're getting the water source for the towns and the public water supplies.
Yeah, and
Most of the water is treated, so it's sort of irrelevant. But
Yeah, it's all treated, and I'm sure that the state does do some sort of testing on their raw water supplies routinely. Positive that they would have to, but yeah, I don't have access to that data. And I would hope that if there was ever an issue with their routine testing, that they would contact us so that we would be aware of it. Yeah,
that's all.
but there's no like shared database for me to just get on there and see what their results are.
Yeah, I think you're ahead of everybody in the state on this. This is amazing.
Yeah,
But coordinating with the state would be a long-term goal. Is you'd really like to just look one place and know what both public and private side of it is.
Well, they'd have to have the database so to be able to do that.
yeah, it would be.
I doubt it.
Yeah, it would be nice if this was just a statewide thing, but the counties are just pretty individual.
Well, you can go to the state and set the pace for the rest of the state. Or coordinating with their information and your information.
Yeah.
They have to pay attention to what we do.
Yeah, I know another county, I think it was Carroll County, maybe came up here a week or two ago and talked to us because this is something that they are really interested in having in their county to use for their sanitarians to go out and do work. And I know that she told me that they've tried reaching out to the state to get help with their maps, and they are not getting good feedback. They just don't have time or care to help counties with this sort of work. So
I think this has to be initiated by local environmental health units in the counties.
yeah,
And
and
that's why ours is so good right now.
it is, and it's definitely, wouldn't be without Sierra at the planning and zoning office, the county planner, to invite us or like ask us if we wanted to use, it's her map, and she just creates like a sub map for us to use. And she doesn't have to do that, but she does.
She's
And
great.
yeah, and it's been really helpful. So, and not every county has a Sierra.
The other thing that's really nice about this platform that the county is operating is that the map layers are transferable. So I'm not aware of anything in the state, but the Maryland Department of the Environment does use the same sort of mapping tools. So they do the air quality monitoring. They have a couple of sites in Western Maryland, and then all of those can then be exported and theoretically layered over this. So you will eventually, at some point, if there is a state initiative, be able to look at different layers of levels. But MDE is the only one I know that's currently using it. We used it during COVID to map testing sites, but that was pretty much the extent of what we did with those state licenses.
You just take John down there.
Yeah.
You print them out.
No, I mean, you just click export and then you import it into this map. It's pretty simple as long as you have the actual data. And I do think that there's more coming from MDE that I'm aware of rather than from the Department of Health. That there's the air quality monitoring that was expanded. There is some of the water source monitoring. And then the new thing that's really starting to take off is the heat monitoring. That's a new thing that's more concerning that the state seems to be investing in.
How often do you update the property map?
I think Sierra is the one that updates it, and she does it pretty frequently. Any of my data, like this arsenic data, if I were to put data on there for, I don't know, like my lake and beach samples, it would just be updated as soon as I sent it to her, and she would be able to do it. With property lines and things like that, I think she does it pretty frequently. I don't know if it's like weekly or monthly, but I know she works on it a good bit. Now, with the tick data, though, I don't know how she does it. She just gives me the link and shows me what to do. But she did give me something that I can take out in the field, and whenever or whoever is doing the tick surveillance, it tracks their location, and they can enter in the number of ticks that they collected, the species of ticks that they collected, and it would automatically update in real time,
You test
like
those-
this map. Yeah.
How many, do you test those ticks for Lyme?
Mhm.
And so you have that information on how many ticks were positive.
I mean, not right away, but that's something that I could update. I would just have to create the data set and send it to Sierra, and she would be able to do that.
A lot of applications.
Yeah.
Great.
Melinda, I'm just looking at this, the Garrett County government site with their mapping dashboard. Can you remind us, how do we see the environmental health layers? I don't see them popping up automatically, or maybe I'm not looking in the right place, or are they not visible to the public yet, what you're showing us?
Yeah, so a lot of what I'm showing here is just what I see on the private side of things. So not all of those layers are available to the public. I think
you should be able to see things like the blue line streams. You should be able to add contour. You should be able to change the base map. But as far as, all these other layers, like you wouldn't see the subdivisions. You should be able to see public utilities. But this kind of stuff, that's all in the office with the perk test and the wells and the septics. Right now, that's not available to the public.
I love the idea of getting the rabies encounters and, having the tick surveillance information. Is really great. These are great ideas. Thanks.
Any other questions? All right.
So this would be possible if we went as far.
Well, thank you.
We're fine.
Lincoln was a property now. Actually, I think it started back.
Slow morning.
Okay, our next speaker is Judy Carbone with C-Works.
Involved in for the years.
Good morning, everybody. I'm rather low tech. I have a PowerPoint, but thanks to Laura, she's going to pass out a few things. So my name is Judy Carbone. It's always hard for me to say what my affiliation is because I wear a number of different hats. But all of them are in community service organizations. And today I'm here to talk to you about a new project that's going on that we absolutely see connected to our community health. And it's an organization called Community Works. So just to give you a little background, one of the things that first sparked my interest in something like this was back in, and Shelley's going to laugh because she's heard me say this a zillion times, was back in the 2019 to 2021 community health assessment. I was really fascinated by what I read there, but page 15, and I'll never forget it, really stuck in my mind. And I even brought it today so that I could show you what I'm talking about. So it's a part of the health assessment that talks about what some of the challenges communities feel in living in Garrett County and what are some of the good things. And so on the page it says, what do you love about living in Garrett County? It has things like a sense of community. Everybody is related, very friendly, waving folks. If there's a need, the community comes together. There are kind people always watching out for you. Some of the wonderful things that we all have experienced living here in Garrett County. That was page 14. Then page 15 came about. And it basically says, based on the focus group analysis, there was this one outlying piece of information that they wanted to include to give a perspective of another perspective. And it was entitled, A Longing for Respect and Belonging. And I just want to read it to you real quick because I just find it to be fascinating. In contrast to this theme of what do they love about living in Garrett County, discussions with those that have had dissimilar experiences in small towns in the county were explored. This quote is taken from a focus group that may challenge your perspective. Quote, there is a difference between a polite community and one that fully embraces a person, end quote. If you've never been the person treated differently, it may be difficult to understand that. However, when asked the open-ended question about what makes a community healthy, the notion of the need for belonging kept surfacing. Regardless of whether you are from the area or not, being different in any way is perceived as a risk or disadvantage in Garrett County. One person put it this way, it's a safe community for everybody unless you're on the margin. And that just really stuck with me so much. I can tell you it's page 15. It just really stuck with me because there is this sense of certain groups feel very connected with each other, but try to cross groups sometimes, and it's really hard. I think most recently, is this still a valid concern? Most recently, I think the work of the Diversity and Inclusion Committee kind of shows that yes, it absolutely is. So that's kind of the background. And also I should say my background as a counselor and a career counselor and a volunteer coordinator. I really wanted to try to figure out what we could do about that. And so going through a number of different things that happened, we came across a group called the Rural Urban Bridge Initiative out of Virginia that is trying to connect people who are different, particularly over the political divide. We all know that polarization in communities, particularly small communities, is ripping us apart in many cases. So the Rural Urban Bridge Initiative is trying to bring rural communities more together around the needs of the communities. And one of the programs that they have is a program that they call Community Works. And the idea basically is through good acts of good service to our community, you bring people who are different together, not to try to convert them or convince them that you've got the right opinion, but just to try to say, hey, we're neighbors too. And we all care about our community, and let's focus on what makes us common, regardless of some of those margin kinds of things that might make us different. So that's what Community Works is all about. And Ruby, Rural Urban Bridge Initiative, has been doing pilot programs for Community Works in primarily Virginia and Georgia in rural communities over the last couple of years. And they've just recently said, we'd like to expand. So I'm proud to say that Garrett County is now the first Maryland community to have a Community Works program. We became an official chapter of the Ruby's Community Works program in April, so we're brand new. We're just starting. But already in that time, we've been able to go out and do some community service work for some of our local organizations to say, be a good neighbor, come and talk and work side by side, and let's do something good for our community. In May, for example, our very first initiative was helping Cindy's Fund at one of the activities at the fairground. We just helped table and make food and talk to people. And, you know, I think, first of all, Cindy's Fund learned about some new potential volunteers. Those volunteers learned about Cindy's Fund a lot. And they got to talk to other people in our community that they might not on a normal basis do. Also in June, the beginning of June, one of our greatest partners right now, our community partners, is Community Action. And in June, we got together a group of volunteers to go over to the 360 Access Hub. Shelley was there, Chris Mullet was there. We painted, we cleaned, we scrubbed, we ripped things up, we put things together, all in terms of getting the 360 Access Hub up and running. And in that one afternoon, we offered 56 hours of community service by about 16 participants. And we've been back to the community, the Access Hub, in doing additional painting, and hopefully a group's going to go today and unload food. Those are just examples of some of the things that we've done, but we're just started. We're just getting started. This week, we're going to do an outreach to some of the other organizations that are in the community to say, if you had a couple volunteers, what would you do? And to try to get some ideas from those organizations. We've been growing our volunteer list as we've been going through this 2-month journey so far. We've got a volunteer list that now when our community partners come and say, we've got a task for you to do, and we're looking at very specific tasks. We're not looking at, here's a problem we need to go solve it. Or we're not looking at, send somebody every day for this kind of thing. We're looking for specific tasks. So then we can go out, recruit a group of volunteers who maybe have never worked together to just learn more about each other, learn more about the organization, and learn more about Garrett County. I'm really excited about this. I don't know if you can tell. I'm really excited about this because I do think it will help in trying to bridge some misunderstandings certain groups may have about each other if they can be shoulder to shoulder working on a good works for our community. And so do I see this as a way of enhancing our community health? Absolutely, 100%. And I was really glad when Shelley offered me the opportunity to come and just tell you a little bit about it. What I really love, if I could do an ask of the folks in the audience today or online, is if you are interested in learning a little bit more about who we are and what the organization is all about, there is an email on some of the sheets that Laura just passed out that we could add you to our volunteer list so that when we have some of those opportunities, you'll start to hear about them. Our target right now is to do 3 activities a month. I have a feeling that's going to grow as we go through this more. So please think about getting on our volunteer list. If you're an organization that might need a day of volunteering and some people to come, let us know that too. Please send an email to Community Works Garrett, and we will see what we can do in terms of getting you on the calendar and trying to send people. And if you just have an idea about how this project could be more productive and expand, I'd love to hear your ideas too. So I know that's kind of short and sweet, but does anybody have any questions about what we're trying to do and why?
Is it this effort primarily by the Garrett County Democrat organization?
So the Garrett County Democrats started a couple community initiatives. You may have heard about our Let's Drive program, where we've been paying for driver's ed scholarships for the last 4 years. We've had almost 200 students get scholarships through the program. It was done in cooperation with organizations, not on political or partisan lines, just as the need of the community. It just happened that that group that started it happened to be the Democrats, just like a church starting an activity or a service organization starting an activity. Another one that we do is Seniors on the Move, where we actually raise money through grants and businesses and our own donations to pay for, we've done almost 10,000 trips right now for seniors who want to go to a senior center or go to the park. And we also help in organizations, Soup for Seniors, get food for seniors on a monthly basis. That's part of bridging that political divide. We're not there again to try to recruit people to the party. We're there to say, we're your neighbors too. And all of this animosity that's going on in our community, not only our community, across the country.
Do you have any Republicans on your leadership boards?
So we just started, so it's started internally, but do we have room for it? Absolutely 100%. Have we reached out? Absolutely 100%. This is about the community. So Community Works is a separate entity. It's a separate program. It's a separate organization. We are a chartered member of that. It just happens that the group that started it had a commonality of being Democrats. Does that answer the question? Okay, thank you. Does that, let me ask you this. So does that make you think differently about the program? Putting you on the spot, I apologize.
No, I just wasn't quite sure, you know, whether it was going to maintain a group of Democrats or whether or not your objective is to make it a general organization to do some kind of things.
It already is. It just happens to be the people starting it seem to have this commonality. But it already is.
So it remains to be seen, I guess, what occurs, whether or not you're able to spread out or not.
So, and that will tell us something about our community too, won't it? If it doesn't. So no, it is our intention. As I said, it's not the t-shirt doesn't have Garrett County Democrats on it. It has Garrett County. So it is about the community. It's a group of people doing something in the community. So we hope, you know, it's not that we're trying to not be transparent in who the original group is, but the intention is to try to bring people together. So, yeah.
Do you have any key Republicans into it yet?
So we're 2 months in. We're 2 months in. There have been outreach made. Yes, there have been offers made.
Sometimes if you don't start with them, you never get them.
Yeah. Well, we're not going to let that part start.
Then discover that there's a need and then join them in what they're doing with the community somehow.
Yes. Yes.
The fact that you discovered it, they don't want it.
Yeah, well, and that's, I said, that's why I asked the question.
Nationally, it's so bad.
I know.
If somebody else did it, then they don't want it, whether it's good or not.
Well, we're not going to let that stop So I mean, we have done outreach. It hasn't been successful yet, but again, it's not for lack of initial trying. We're only 2 months, so we're trying to get more. But absolutely, in terms of when an organization reaches back out, there's no conversation about what the politics are. When a volunteer comes to us, again, there's no conversation about what their politics are either. But in terms of us doing outreach to groups that are traditionally Republican, absolutely we are doing
Good luck.
it. We're gonna try. Never say never.
Always optimistic.
Well, thank you. I appreciate it. And again, I look forward to your questions and maybe your involvement too. And thank you, Shelley, again for inviting us.
Thank you.
Okay, we're up to Jennifer here for our HPC consumer membership.
Okay, so you might remember last month we tabled our consumer membership nominations and votes. Beth got with Carol Raleigh at the county and found out we needed 3 people, 3 new consumer members due to expiring terms and just vacancies. We do have 3 nominations. We have Tom Dabney, Judy Carbone, and Ashley Gilcher as have been nominated. I will take any other nominations at this time. If there are none, then I think I need a motion to accept these nominations. Okay, have a second?
Second.
Okay, and a vote for people that are members of the Health Planning Council. Please, if you agree with the motion going forward, please say aye.
Aye.
Okay, any opposed? All right, we will submit these nominations to the county for approval and hopefully acceptance. Thank you.
Jen,
Yes. Yes.
good morning. Hi, this is Christy Record. I don't know if I can make a motion for myself to stay on the Garrett County Planning Health Policy Council or not.
It's not been on for several years. I mean, she's always welcome to go 10 minutes.
So you have not been on the planning council for a while. Do you want to add yourself as a nomination?
Yes, as just a general citizen, please.
Okay, so now we have 4.
Now, this would be a consumer member.
Yes.
So, do you have some direction for me, Beth? What do we need to do?
No, I've not had this situation.
We've never had an abundance of nominations.
Yeah, we already voted.
I would say we already voted. We didn't. That's a very good point, Rodney.
Well, I know, but these vacancies come up often, and so.
Yeah,
the
when
fact
is
that
the next
Christie says-
vacancy?
In a year, we have several that, yeah, I would like to be able to call you, Christy, if, for next year, definitely.
Okay, that's not a problem. No worries.
Okay, there we go. That's what we'll do then. We'll submit these 3, and then next year we'll keep your nomination open, Christy, for the next vacancy.
Okay, perfect. Thank you.
Yeah, it's always good to have volunteers.
Definitely. Definitely.
Yes, my school schedule the last couple of years has kept me from attending meetings. I was always catching up with the minutes and the plans. And thank you, Beth, for always including me in that. So anyway, I was excited to actually just be able to get on and catch up and actually hear everybody's voices instead of read everything off of the paper.
Very good.
Good seeing you.
Okay, we are at agency updates. Anyone in the room want to offer anything?
I do.
Go ahead.
So I think John's gonna put something on the screen for me.
John can't see this far away. John is getting older.
All right, so the Commission on Public Health, which I'm sure most of you are familiar with, their task that they've been completing for, I think, 2 years. They have completed their preliminary draft recommendations, and now they are seeking public input.
And if you scan that or take a picture of that with your phone, it will take you to the link where you can review all the recommendations that the commission has made. And they would like for your comments and, you know, whatever you think. This code is also out on the sign-in table, so you can take a picture of it there and it will take you to the link too. The comment period closes, I think, July 9th.
And we will send it out too.
Yes.
So it'll go out with the newsletter and all that. Stuff. And then also the link, because I know some people can't scan. That's there as well.
And then additionally, the health department has hired, we were finally able to offer the position of our deputy health officer of operations. The candidate who has accepted the position is Martin Kraska. He will begin also on July 9th. He is a 10-year Air Force veteran, most recently employed by the Maryland Hospital Association.
Anything else? Brett?
Okay.
How about online?
Medical.
Any reports from anyone online? Sadie?
Good morning, everyone. Yes, I wanted to announce that the local behavioral health authority has partnered with a young man to build us a little food pantry. It's located upstairs outside of the behavioral health unit. I'm very excited about this. This was a service learning project for him. There's going to be a press release coming out in the newspaper soon about that. So we have another food pantry in the area for non-perishable food and hygiene products. Dental Health has agreed to supply toothbrushes and toothpaste, and we just encourage individuals to stop by and put some non-perishable foods in there, because the more places that we have these, the more people we can serve.
Anyone else online? I don't see anyone else, so we will go ahead and close the meeting. And just a reminder, we do not have a July meeting, so our next meeting would be August 28th. 8 a.m. What's that?
I think we're planning for a July meeting.
Oh, all right. Wasn't on here.
Oh, that was my oversight. There is a July.
Oh, there is a July meeting.
Yes, I'm sorry.
What date is it?
Uh-huh.
Harvest house.
The
20.
July 24th will be the next health planning council meeting. With no further business, we will adjourn the meeting. Thank you for attending and thank all the speakers.
It's so.
I'm still waiting on mine.
Yeah, they're pushing out. It's place where. You know where it's at.